This is our assignment 3 physiology by Emmy and Lizzie.
Central nervous system, along with dopamine levels that are naturally found within the body. Dopamine is the strength of the heart and the electric action of the substance has been sorted. There is only one mechanism that it can being in prison. Also banned within the sporting industry by all sports organisations and performance would be poor. Due to the fact that cocaine is a stimulant, it allows his athletes to train longer, therefore looking at sports such as MMA fighting, they can increase their alertness and decrease the effects of fatigue. So the positive
So moving on to blood doping. This is a type of oxygen-related way of improving an athlete's performance. When it's not used for performance enhancement, it's used medically for emergencies, when there's no time to match up a correct blood type matching the patient for a transfusion. Blood doping is carried out by taking 2 pints of the athlete's blood out their body a couple of weeks before the event and freezing it. If the athletes were to perform at altitude when the blood is taken out, this will increase the red blood cells, allowing the body to have more red blood cells when injected back into the body. The process of the injecting is normally done 1 to 2 days before the event, allowing the frozen blood to thaw. There are 2 types of blood doping. One when the athlete uses their own blood, which is auto something, and the other one is the homo, and this is removing fresh blood from another person straight into the athlete. The side effects of blood doping will increase blood viscosity. This will cause the blood to become thicker due to having an increase of red blood cells circulating the body. This causes the blood flow to decrease and make the heart have to work harder to pump more blood around the body. Due to the slower movement, this can cause heart attacks because of stress on the heart having to pump faster to ensure the nutrients get around the body. There are also a couple more side effects to the homo transfusions, such as allergic reaction and the risk of blood disease, for example, Hep C and Hep B. The sports it can be used in is normally an aerobic events, such as endurance for the participants. This performance enhancement is normally used for long distance running and cyclists. The reason why these types of sports have to use blood doping is for their personal gain, to allow them to use their oxygen more efficiently. When putting the blood back into the body, there should be an increase of red blood cells, which will increase the amount of hemoglobin present as well. Therefore, having more numbers of hemoglobin will allow more oxygen to be transported around the body, which will give the working muscles an efficient amount of nutrients to keep working. It will also allow the body to not go into the aerobic energy system, which can reduce the amount of lactic acid, which could cause fatigue in athletes. So the positives and negatives of this. Positives of using blood doping within performance is that it will help the body become more efficient with transporting the blood around the body. Therefore, an athlete doing an aerobic event, such as long distance running, their working muscles will have the correct amount of oxygen and nutrients needed to work efficiently and help enhance their performance. The positive of using blood doping on athletes' health would be the body will less likely become fatigued and tired in everyday life due to the amount of red blood cells in their body, because the organs and muscles are getting the correct nutrients. But obviously, if the blood becomes too viscous, this can cause damage. The negatives of blood doping on the performance will be thickening of their blood. This will cause an increase in their heart rate, being the heart will have to work harder to pump up around their body. Being more viscous because of the higher amount of red blood cells. This will decrease their performance because the oxygen won't be able to get to the muscles fast enough to just supply them with an efficient amount. Similarly, the negative part of their health will be that they'll be more open to having heart attacks because of the stress of the heart will be going through during exercise. It will put the body under a lot of pressure, causing it to fatigue and become weak.
Effects on human life, hence why it is a substance. The main forms of abusing down high risks of HIV and AIDS. The short-term effects of heroin include a rush of relief and feelings of anxiety during the kill before going back into sport. This would make the injury worse, especially due to the nature of boxing with a lot of hits to the face. Like cocaine, heroin is a legal Class A drug. The substance include pain relief of potential injuries or recurring ones. It also relieves them from anxiety, fear, and any other issues. Looking at a sporting perspective may mean they perform better due to them not being nervous and instead be able to focus on their sport without any worries. However, the negative effects due to side effects from nausea cause their sporting performance to deteriorate due to them not being in the correct mindset to execute the correct techniques needed for their sport. This lower heart rate and breathing is essential the entering the body transported to far from
On to anaerobic steroids. They're used to help increase muscle growth for the body. It was firstly developed in the late 1930s to help cure the lack of testosterone in the body because the body won't produce it enough. When it's used for performance, they will consume the steroids in what way they wish, such as injection or tablets. Once this is in their system, the athlete will need to train to see the difference in their body, and every time they should use the steroids, they normally should increase the doses to reach a peak performance. There are many medical reasons why the anabolic steroids are used, such as a form of anemia and delay in puberty and severe cause of osteoporosis.